Everybody, myself Dr. Manish Mahajan. I work at Kailash Group of Hospital as a senior consultant nephrologist and senior consultant physician at Greater Noida branch. As we all know that 17th May is a World Hypertension Day, which is a very significant day for all the health care workers in India and abroad. Why it is very significant? Because it is a day wherein we generate awareness about the hypertension among a general population to prevent the complication of hypertension. What is the complication? What is the awareness? So as we all know that hypertension is a condition wherein your BP remains constantly high for more than 130 to 80, constantly even doing lifestyle modifications. So if your BP is more than 130 to 80, you must visit a nearby physician or a doctor to get yourself checked up. And why it is so such a serious complication? It is a very silent condition. It is a silent killer wherein most of the people, they do not experience symptoms unless they don't visit a healthcare doctor nearby for a normal checkup, maybe if they are having fever or any other normal minor conditions. And when they go there, the first thing which a doctor does outside is to get their vitals checked up, and therein they get diagnosed that the BP is high. And every day 1 or 2 patients which I see in a OPD, they get diagnosed by high BP, which most of the patients in Indian population, they do not know. And we also know that we majority of Indian population, we have got a very high sensitization of salt. In a general, our requirement is not more than 1.5 spoon of salt to be consumed in 24 hours, but then we consume a lot of salt in our dal and all those vegetables and in every kind of meal that we eat. And apart from that, we also consume pickle, which gets very high salt content. So as many as more than 70% of Indian population above the age of 55, they experience subclinical hypertension, which means their BP remains more than 130 by 80 or maybe 130 by 90, and they do not experience any symptoms, but it doesn't mean they are not hypertensive, they are hypertensive. So explain about hypertension, what it is, why it is so important. It is one of the leading cause of premature death worldwide. And why? Because it has got serious complications. It can lead to kidney disease, leading to renal failures and cardiac arrest and other cardiac ailments as well, and brain hemorrhage, stroke, etc., etc. And we should know who are the people at risk. Of course, people who are inactive with work, old age, obesities, who are having sedentary lifestyle is one of the conditions as well, and people who are having the family history of hypertension as well. And also we have seen obesities and type 2 diabetes. As we know that India is a diabetic capital of the whole world. More than 50 million of Indian population are having type 2 diabetes. When type 2 diabetes and hypertension, they both amalgate, they lead to lot of serious complications like cardiac problem and kidney problem. So it is very important and paramount to prevent it and cure it. We cannot cure it for sure, but then we can control it, leading to prevention of the complications which I just spoke about. So how do we prevent it? Of course, as we know that we eat a lot of salt and we eat junk foods. So avoiding junk foods and limiting the salt and fatty foods are important. Exercise have a very important role in managing type 2 diabetes as well as in hypertension both. Why exercise? Because when you do exercise, it decreases your systolic by as much as 20 or maybe 10. If likewise, as I just said, majority of Indian population above the age of 55, they experience subclinical hypertension. Therein, the exercise and dietary lifestyle becomes very important, because when you change your lifestyle and when you start exercising, doing yogas, so you can control your BP to a greater extent and where you may not require any medication. But then, apart from lifestyle and dietary changes, even if your BP remains more than 140, 150, you must visit your nearby physician, maybe a cardiologist, a physician, or maybe a nephrologist if you are experiencing renal hypertension as such. So, if you detect early, prevent early, control early, you may avoid lot of significant and complication which leads to other morbidities and mortalities, and in this way we can prevent lot of fatalities in India, around the world as well. So it is a very important morbid condition in Indian population, as our dietary habits and contains a lot of salt, and many of the people, they are very inactive with work, and sedentary lifestyle, which is very significant, and a majority of also the population of India, as we see that they are working with IT, as well as they are experiencing type 2 diabetes. They experience hypertension due to strenuous work and others. So on this day, 17th of May, I wish all the Indian population and worldwide remain healthy, eat less salt, and do yoga, exercise, eat less fatty food. If you are diabetic, control diabetes, and live healthy and live longer. Thank you.